During the month of May, people have been discussing what causes fibromyalgia, treatment of fibromyalgia, basically just being aware of what it is and what it is not. For years, people thought it was just in somebody's head, but they found that it is a definite condition. Today, we have Dr. Eriksen, who is a chiropractor. He has recently returned from a seminar in which some of these issues have been discussed. And Dr. Eriksen, I have friends who have fibromyalgia, and I have a friend who has another condition that I would like to discuss later. But why do you think that chiropractic health care is helpful of someone who has fibromyalgia? First of all, what is it?
Yes. First of all, is fibromyalgia real? Is it a real problem? And of course, if you have it, it definitely is real. It's, generally speaking, it is a condition that is defined by patients who have chronic diffuse pain in their muscles, tendons, and joints. The American College of Rheumatology has defined and mapped out 18 tender points in the body, and if you have 11 out of the 18 and you also have fatigue and a few other symptoms, you're probably going to get diagnosed with it. But what's interesting is that they've done detailed studies of these tender points, and they've looked at that, and the tissue is absolutely normal. There's nothing damaged, there's nothing abnormal with the tissue.
But it hurts.
But it hurts. So really, a lot of scientists have really determined that really what's going on is a problem with the processing of the brain's ability to process pain. So it's a problem with the central nervous system, and that's where chiropractic care comes in, because what I do as a chiropractor is I specifically find areas of irritation and stress to the nervous system and remove it so that the body's able to function in a more appropriate process.
Oh, absolutely. You know, for a while they thought it might be virus or something. He has written 2 books right now. He's got more on the way. He's even got a book on football coming out, and Harry Wayne Parrish should check that out. But anyway, the type of chiropractic care that he offers, explain the difference. And you see the upper cervical is basically what you do.
Sure. Well, we, of course, evaluate the entire spine, but what the studies are clearly show is that the upper cervical spine is the most significant area of potential for having stress on the nervous system, because you're basically looking at the area of the juncture between the brainstem where it hooks right into the spinal cord. And so a misalignment that creates stress in this area has potential of affecting a significant portion of the central nervous system and the body's ability to relate to its internal, external environment. So as a chiropractor, I do not treat diseases or conditions. I basically correct dysfunction with how the body's working and allow the body to work at a more optimum level.
Well, one thing, you're going to be doing a health seminar, free, which will discuss treatment of conditions like fibromyalgia.
Yeah, I'm going to be doing one in June and one in July, and you can contact my office for the specific dates. But really, I want to take 40 to 45 minutes and really go over many different areas of health and wellness, because we know from scientific studies that there are really some simple, practical things that we can do to significantly reduce our risk of developing cancer, heart disease, reducing chronic pain. And these are things that we can teach people, and things that are very inexpensive and easy to apply to their lives.
And so now I want to not miss this opportunity. Chiari, what do you call it? See,
yeah, Arnold-Chiari malformation.
and that is something where at the base of your spine.
Basically, what's happening is what's called the cerebellar tonsils, and I guess we could say part of your brain literally is kind of peeking out of the foramen magnum, which is the hole where your brainstem hooks into your spinal cord. So it's right at the base of your skull. It's an anatomical issue. We had a very prominent medical radiologist named Dr. Hartsfield that lectured at our conference in Atlanta last weekend, who lectured on this.
Wow.
And she, of course, went over the MRIs and really, of course, reviewed how we can help these type of patients.
In other words, when doctors say we wouldn't touch it, we're not going to do surgery, just live with the pain, that's fine. But if you have to have the pain, nobody wants to live on pain meds all the time. So how can your type of chiropractic care help?
Well, obviously, if someone has this problem, they're going to be very concerned about having much done to this area. But you have to understand the way we adjust the spine in the upper cervical area is so delicate that you barely feel anything being done. But it all has to do with the specificity in the way the adjustment is done. There's no twisting or forceful manipulation of the area that's required. We adjust little tiny toddlers with this type of method, and they tolerate it very easily.
Oh, my husband went to you after he'd been to a traditional chiropractor. He said, he didn't do anything to me because you're manipulating, but he felt a lot better afterward.
Absolutely.
So that's the secret, is and so not overdoing it, but a person can get relief, tremendous relief from any kind of arthritis, fibromyalgia, or even this horrible Chiari. Is it?
Arnold Chiari malformation,
I'll
possibly.
let you say it.
Possibly.
So, but hopefully there's help. And in your books, there's discussions of those types of things.
Yes, we published a case in our office back in the late 90s of a nurse who had Arnold Chiari malformation that had just a whole host of serious signs and symptoms, and she made a just miraculous, complete recovery within a very short period of time. And of course, we wrote this up and published this in a research journal.
And so that's what is important. You know, no one can guarantee, you can't even on medicine, you can't guarantee it on anything. But if you have case studies, techniques that work. So right now you need to, if you would like to call the office, it is 793-7992. It is an alternative treatment for fibromyalgia and related conditions. Or go online, and he has a lot of information on his website, www.chirohealthinstitute.com. And remember, 2 free seminars this summer. Thank you, Dr. Eriksen, for being on our show today.